Do you know that there could be silent killers harming your cat without you even knowing about it? I have a new cat, his name is Cassian, and this is something that's really important to me as well. Today I'm going to show you 5 of the most common hidden threats to your cat's health, and most importantly, what you can do about it.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Today, let's first start with a big one, CKD or chronic kidney disease. It's estimated that upwards of 1/3 of cats over the age of 13, they're going to develop CKD. And unfortunately for many of the cats, by the time they start to show clinical signs, over 75% of the kidneys are completely damaged. They're no longer functioning. Some of the clinical signs you might expect to see: increased drinking, increased urination, larger clumps in a litter box. Your cat's drinking more water, urinating more often because the kidneys are no longer functioning properly. They can't properly filter the blood. They can't then properly retain water. So because of that, increased drinking, increased urination. You might initially see vague signs, a cat that just seems a little bit off, a little bit lethargic, they have a little less energy, slightly lowered appetite. Then as the disease progresses, it gets much more serious. These guys will completely stop eating, completely inappetent. Often in this case, when you start to look into a cat's mouth, you might see oral ulcers as a result of the uremic toxins building up. That's increased urea and creatinine in the bloodstream. Many of these cats are going to have really bad breath, and often that can be the first clinical sign that someone goes into the vet clinic with. And it really is incredibly common. I'm sure in practice, I diagnose literally hundreds and hundreds of cats with kidney disease. Even 2 of my own cats have had kidney disease. But there are a few things you can do to potentially prevent this from ever happening to your cat. Number 1, give your cat far less of these, less vaccines. There seems to be a pretty good correlation now between the number of vaccines, the frequency of vaccines. So what's happening is you're frequently vaccinating your cat. You're stimulating the production of antibodies. Sometimes the immune system reacts inappropriately. And in some cases, it's attacking and damaging the kidneys. You get a damaged kidneys, you have a cat with kidney failure. Way less vaccines. My cat Cassian here was recently adopted from the SPCA. He will be getting no further vaccines. Keep your cat well hydrated. Water fountains to encourage water consumption. Stop feeding your cat kibble, dry and water depleted. Make the switch to something like this, a high quality canned cat food. You want the foods that you're feeding to be lower in phosphorus. Seems of all the different ingredients that can be tied to kidney disease, it's phosphorus levels. So foods low in phosphorus are ones that are lower in bones. So you want to avoid things like fish. Often they're grinding up bones. Fish in the food typically means higher phosphorus levels. Consider the use of phosphorus binders just to further decrease the amount of phosphorus in the diet, decreasing the chance of your cat getting kidney disease. One option could be a calcium supplement, say 500 milligrams per day. Or you can consider a cat-specific supplement such as ours, which has additional calcium but has no phosphorus. So because of that, it's going to bind some of that phosphorus in your cat's diet, decreasing phosphorus levels. Additional essential fatty acids may be helpful. They do a great job of decreasing inflammation. Less inflammation, lower kidney damage. Then you may also want to consider additional probiotics. There's a specific veterinary probiotic called Azadil geared towards cats that have kidney disease. And what it is, it's a nitrogen consuming bacteria. So what it's doing, it's consuming some of those uremic toxins, decreasing some of the signs and symptoms that we see in kidney disease. Within our cat supplement, we have additional probiotics, including Lactobacillus acidophilus. Number 2, hyperthyroidism. These are cats that actually have thyroid tumors. They're producing too much thyroid hormone. And this is a hormone that regulates metabolism. So these are cats that are going to have weight loss in spite of having this increased appetite. They're eating a lot, losing weight. They may also have increased drinking, increased urination. They're going to have marked elevated heart rate. And if you put your thumb and forefinger in here, just in the corner of your cat's right and left armpits, you're going to feel this racing heart exceeding 240 beats a minute. You might see GI signs, vomiting, diarrhea. They're going to have a pretty unkept looking hair coat. If it's untreated, they're going to have marked weight loss. These cats are going to actually have heart disease, a condition called HCM or hypertrophic cardiomyopathy. They're going to have high blood pressure. They may suddenly collapse. They might even go blind. If you see the clinical signs, you first go see your veterinarian. They do appropriate blood tests. They can determine the underlying cause. So one of the big things with their cats that are hyperthyroid is preventing them from developing hyperthyroidism. Like there's something going on in the diet. There's something that we've altered to turn all these cats into hyperthyroid cats. 25 years ago, very few veterinarians had seen a cat that's hyperthyroid. Now, you might see one every few days. So to potentially prevent hyperthyroidism, number one, less vaccines. Less potential antibodies that are stimulating the immune system that are potentially attacking the thyroid gland. Less inappropriate responses from the immune system. Like, why are these thyroid glands becoming cancerous? And then really focus on the diet. What they've seen is, number one, clear links with soy. If you've got soy as a protein, we're seeing a marked increased chance of your cat being hyperthyroid. So less soy. Just make sure that if you're going to be feeding your cat food, which you are, that it includes a real animal protein, i.e. this, which is turkey. Whatever you can, ensure that there's no soy in your cat's food. Focus on eliminating this one toxin called PFCs. So anytime you look at the inside part of a can, of many of the cans that are really shiny, so stuff doesn't stick to them, those are sprayed, which includes a toxin called PFCs. We know PFC consumption directly correlated with thyroid disease. So focus on high quality companies that are ensuring that their products are PFC free. The conventional veterinary treatment of I-131, that's radioactive iodine, it actually works really well and it's not very invasive. If Cassini were to be hyperthyroid, that would be my treatment of choice. Based on his current weight, he's eating a lot, but no, he's not losing weight. This cat is not hyperthyroid. Cassian. You want to make sure in these cats that you avoid additional iodine, because that's the mineral that the thyroid gland requires for growth. So one of the ones, there's a supplement called Plaque Off. It's often used for dogs and cats that have dental disease. It's all iodine. It's high in seaweed. So avoid that. There are some holistic options to consider. Number one, there's a herb called lemon balm. Doses about 1/4 ml of the tincture per 10 pounds of body weight daily. There's an amino acid called carnitine. It seems to help people with hyperthyroid and may help your cat. Doses of about 100 milligrams per 10 pounds daily. Then there's a homeopathic called Natmur. And interestingly, it's actually been studied, and they've actually seen some successful case studies where cats that have been hyperthyroid were treated with this homeopathic. So the dose would be Natmur 30C, 130C capsule twice a day. Number three, another metabolic disease that I'm kind of worried about with this guy, I'm going to get his weight under control, is diabetes. So with our cats who become diabetic, typically they're type 2 diabetics. So what that means is their pancreas still produces insulin, their cells no longer respond to the insulin. But regardless, what you're seeing is they have elevated blood sugars. And then some of the same clinical signs you're going to see in many people. Increased drinking, increased urination, weight loss, urinary tract infections, muscle wasting, lethargy, vomiting. And a unique clinical sign you might see in a cat is they walk with their hunches down, sort of down on the ground, and they're walking really low like that. So what's happening is the high blood sugar is affecting the nerves, called a diabetic neuropathy. Their legs aren't working properly, hence they're walking all hunched low to the ground. So the single biggest thing we can do with our cats is eliminating the carbs. So get rid of the kibble, this high carb kibble. That is the single biggest reason why we're turning our cats into type 2 diabetics. We want to get them on a high protein, high quality canned cat food. It could be one that's homemade. It could be one that's raw. Regardless, they're designed to break down and digest protein, and that's what they need. And I'm finding that the bulk of the cats, if you can get them off of the kibble, the high carb kibble, you can reverse their diabetes without insulin. Number two, there's a mineral called chromium. It's been well studied, been shown to be beneficial for our cats that are diabetic. It's in many of the veterinary foods specifically targeted towards our animals with diabetes. Turns out the chromium, it's in really high levels in this brewer's yeast. Also a great source of B vitamins, super inexpensive. You can be giving 1/4 teaspoon of brewer's yeast twice a day to your cat. That'll increase the chromium, potentially help him manage his diabetes. This antioxidant, CoQ10 or coenzyme Q10, it has been extensively studied for diabetes. It's been shown to lower fasting blood glucose. It's been shown to help the cells better respond to insulin, hence reversing some of the signs of type 2 diabetes. CoQ10 doses, 10 to 20 milligrams per cat daily. Number four, heart disease in our cats. 50% of all cats that have underlying heart disease, they don't have a heart murmur. You go to listen to your cat's heart, your veterinarian does, sounds pretty normal. That was upwards of 50%, wouldn't have a murmur. Meaning heart disease can go completely undetected until something really tragic happens. So what I've seen in practice many times are these cats that present with sudden collapse. What's happened is they've had underlying heart disease. Their heart is not beating normally. The blood actually pools within areas of the heart. It forms a blood clot. That clot's going to go somewhere in your cat's body, typically back into their rear legs. It'll lodge sort of inside in here, and all of a sudden they've lost all the blood supply to one part of their rear limb. The acronym is known as FATE, or feline aortic thromboemboli. Clinical signs include rapid or open mouth breathing, sudden weakness or collapse. These guys may be dragging their rear leg. If you lift up their lips, look at their gums, it may be pale, maybe blue or cyanotic. And if a cat ever has a thrombus, one of these blood clots, it's very painful. You're gonna know like there's a serious cat emergency. Some of the preventive things to consider and supplements then correlated with improving heart disease. If your cat has a treatable condition, i.e. hyperthyroidism, make sure that's treated so he doesn't get heart disease. We know there's a decreased correlation with heart disease and omega-3 fatty acid supplementation. So add in additional omega-3 fatty acids such as ours. Dr. Jones' Ultimate Omega-3 formula for dogs and cats. Then lastly, if your veterinarian has examined your cat, heard a murmur, suspects heart disease, consider CoQ10 supplementation. We know it's this antioxidant that's really important for cells in the body that have a high oxygen demand. The heart muscle, that's one of the big ones. It needs a lot of oxygen. So if you can supplement with additional CoQ10, you could potentially support your cat's heart. Doses of 10 to 20 milligrams per cat daily. Number 5, it is cancer, and the incidence of cancer in our cats is on the rise. One of the cancers we're seeing on the rise in our cats is lymphoma, but especially the gastrointestinal kind, showing up as weight loss, vomiting, diarrhea. Some of the cancer signs, it may be a mass that you're feeling on your cat that is firmly attached, which is rapidly growing. The first sign may be a cat that's not eating. Your cat may have weight loss. You can see vomiting and diarrhea, lethargy, bloating, or it just could be that your cat just isn't himself. He's just kind of acting off. So preventively, what can you do about this? Well, first, and it seems to be a familiar theme, less of these, way less vaccines. Because first, we know there's a direct correlation with cats that are vaccinated repeatedly, especially up in here between their shoulder blades, especially with the rabies vaccine, the feline leukemia vaccine. They can develop a cancer called fibrosarcoma. Then when you affect the immune system with repeated vaccines year after year, in my opinion, you're much more likely to see abnormal cell growth. The immune system, it doesn't respond the way it should. Cell growth starts to grow abnormally, i.e. cancer. General theme, if you take one thing out of today's video, less vaccines. The second big theme here, feed your cat better. Many of the cat foods, it's not just that they're high carbs and they can predispose your cats to things like diabetes or kidney disease. They can contain an array of other different toxins. We can have heavy metals like cadmium, arsenic, zinc. Cadmium, for instance, there's clear links with cadmium consumption and cancer. Foods contaminated with mold, foods contaminated with mites. And our cats being on these high carb, dry cat kibble means it's much more likely for your cat to become overweight, develop things like diabetes, have chronic inflammation, and we know there's a clear correlation with chronic inflammation and cancer. So yeah, get rid of the kibble and then get your cat on a food that he's designed to eat. An animal-based protein, one such as this, in a canned food, or it could be a raw food. It could be a homemade food, but regardless, you're feeding your cat what he's designed to eat. In my opinion, way lower chance of him developing cancer. The omega-3 fatty acids, they're also correlated with decreasing cancer risk. When you decrease the level of systemic inflammation, this chronic inflammation, you see lowered cancer risk. So in my opinion, in general, just getting your cat early on a good quality EFA supplement potentially make a big difference. Right, Cassian? Yeah. He's on our EFAs once a day. Consider additional immune supportive products. There's one called colostrum, also known as mother's first milk. It's now being increasingly studied specifically for cancer because number one, we're seeing clear benefits, potentially in both prevention and treatment. Number two, it comes with virtually no side effects. A standard colostrum dose, 100 milligrams per 10 pounds of body weight daily. Then also look at increasing the antioxidants within your cat's diet. Because we also know that anytime cells do their thing, they damage and they die. When they die, they release things called free radicals. And the more free radicals that are bouncing around your cat's body, the more likely that's to cause other cell damage, potentially triggering cancer. If we have more antioxidants there, we're going to have less free radical damage. So that includes minerals, including selenium, key vitamins such as vitamin E, and many of those nutrients, including colostrum, including the antioxidants such as selenium and vitamin E. They're all in our cat supplement, Dr. Jones's Ultimate Feline Health Formula. If you just incorporate some of those suggestions, I think you can make a big difference. Number one, potentially avoiding your cat ever getting some of those diseases. Then secondarily, you just being more informed about them. And if you see any changes in your cat, like any of those kind of warning signs or triggers, go in, see your veterinarian, get a full physical exam, get an accurate diagnosis. And then if you need to treat them, consider a combination of a conventional along with holistic options. Thanks so much for watching this edition of the 5 Silent Killers in Cats. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.